following video is an example of how to have an empathetic conversation about pain with your patients.
Hi, my name is Dr. Gopalsamy, but please call me Anand. May I address you as Mr. Sajan?
Just Sajan is fine.
Great! How can I help you today?
Well, I reached down to grab this milk bottle, and then all of a sudden, I couldn't move. And now I can't get out of this darn boppy.
Oh no, I'm so sorry. Let's see what we can do to help.
Remember the basics of how to have an empathetic conversation. Introduce yourself and your role. Confirm patient's name and how they would like to be addressed. Meet them at their eye level by sitting at the edge of the bed or pulling up a chair. Make good eye contact. Have an open, inviting body posture. And be present with your patient. For time's sake, we will skip the history of present illness, review of systems, physical exam and diagnostics, and resume at diagnosis and treatment plan.
Now, Sajan, you have a left lower back muscle strain. This is very painful, and I'm so sorry. Let me tell you, we won't be able to get rid of your pain completely, but we can certainly make you feel better through this healing process.
Acknowledging the patient's pain and repeating it back to them will make them feel heard. Then, setting expectations is critical to the pain encounter, using phrases such as, "We will not eliminate your pain, but we can help alleviate it." Or, "This is a very painful process, but we will ensure this is not a debilitating pain for you."
I see you came to the ER in the past for something similar. What worked?
I remember they gave me a shot of something starting with a D, dill something. Then I got a week of oxys and some Valium. It seemed to work really well for me, so I'm hoping we can do the same thing.
You know, the meds you received in the past are all narcotics. While sometimes they are needed, we know now that patients tend to do much, much better on non-narcotic therapies. Our emergency department guidelines and even our specialists who specialize in the back all endorse this pathway as the safest, most efficient way for you to recover.
I don't know. I'm somewhat skeptical. I think I will need the good stuff to cut the edge off this pain.
You know, Sajan, my concern with narcotics is that a large percentage of patients have unwanted itching, constipation, nausea. Also, we now know that starting pain medicine here in the ER can unfortunately lead to long-term narcotic addiction when we follow these patients out for a year. Plus, narcotics not only does not make you functionally feel better, but in the future, if these people get hurt, they tend to perceive their pain as being much, much worse.
Okay, I'm willing to try it. Explaining why narcotics can be detrimental and ineffective in the patient's care is critical, but a couple of key points to remember. 1, never personalize the recommendations. Don't say, "I'm afraid you are going to become addicted," but rather, folks who receive narcotics can become addicted to them. Number 2, try to use humor. My favorite line being, "You know the most painful thing about a knee replacement? When you have to perform a rectal exam on yourself to relieve the narcotic-induced constipation." 3, make sure you use language that doesn't make you the bad guy. For example, "Our department's policy," or "Our Pain and Spine Society recommends." This way, the patient should understand that standard of care is now not to use opioids, not that you don't use opioids.
That's great. How about I start with some Tylenol and ibuprofen now here in the emergency department. We are going to give you a very strong anesthetic or a numbing agent and perform a trigger point injection that'll help your pain here in the emergency department. So, you can expect this type of muscle strain to hurt approximately 1 week, but it unfortunately can linger on for up to 1 month. Make sure at home you should continue using Tylenol, ibuprofen, along with a muscle relaxer as needed. But the most important thing that will make you feel better is to do stretches and exercises. Other things such as massage, acupuncture, and warm packs can also help. So after this treatment, how do you feel? Is your pain better?
Yes, it's tolerable now.
Wonderful. You should make sure to follow up with your doctor or return to the ER for all those red flag symptoms we talked about. Do you feel like your expectations have been met, my friend?
Yes, I'm comfortable with our plan now.
Great, you're already ready to go.
Always end the interaction by making sure you verbally state recommendations at home, time frame for how long they will feel unwell, and when to return to the emergency room. I hope this short instructional video can help you have a more well-rounded, empathetic patient encounter around pain.